So APPs are a vital part of our healthcare team. We serve in all the different medical specialties. An APP can be anyone from a PA like myself to an acute care nurse practitioner, a pediatric nurse practitioner, a nurse anesthetist. If you go on any floor in the hospital, you'll find one of us, usually more than one of us, because we serve all those different medical specialties.
We work very closely with physicians, helping care for patients, write prescriptions, diagnose medical problems. And you may not recognize us because we're just part of your medical team, and we blend in with everybody else.
PAs, for example, people think that we're physicians with an apostrophe S assistant, and so we're just an assistant to a doctor, and we're so much more than that. We are your healthcare provider. PAs are able to see you and take care of you and come up with that treatment plan. However, we understand that we are not physicians, and so we're part of that team. So when there is something that is outside of our scope, we then get you to the correct person that can take care of you. And that's kind of the future of healthcare. We will always have physicians, but we help to fill the voids that are present. There are not as many physicians that are going through medical school, and so APPs help to fill that role.
I'm very proud to be the first APP of the year at Northern Arizona Healthcare. And you know, I really love my job, I love what I do, and it was just nice to be recognized for it. APP of the Year nominees include people that are passionate about caring for their patient, are very good at communicating with others.
They're always willing to pitch in and help, even if it's not something necessarily that they need to be doing, it's someone else's job. They always go out for the team, and they're team players, and that has been something we've seen across the lines for all the nominees.
When you're sick and when you're in the hospital, it's a very stressful situation for everybody, especially the patients in the bed. And I think as an APP, we have the ability to take the time to explain procedures, to explain diagnoses, to educate patients, to help relieve that anxiety and fear about being in the hospital and having a new medical diagnosis. APPs choose to come to work every day to take care of our patients, to make our community a healthier community.
We all go into healthcare because we want to help people. We all have our backstories of why we want to help people. My goal is when I see a patient that they feel that their concerns were heard and that they're an active participant in their treatment plan. We all are part of one big team. You know, this is our hospital, and we all want what's best for all our patients. Whether you're an NAH employee or not, we all want what's best for this community.
During the past year, FNP Tarra Young has exemplified the true spirit of community and medical support for the oncology community. During a year in which many challenges have presented themselves to not only the community, but also the oncology department, Ms. Young was the rock that all leaned on. Regardless of the request, team and community were the foundation of the core values Tarra encouraged and practiced. We as a hospital need to recognize her impressive standards and thank her for the hard work and support she has given. Tarra works relentlessly to make sure that her patients are heard and taken care of. She offers support to family members and goes above and beyond. So powerful and so reflective. Emilie deserves tons of recognition for the work she did through the pandemic in her role in infectious disease. Her hard work during COVID should not be underestimated. She was an integral part of making decisions for the health and wellness of our colleagues, worked endlessly when breakouts occurred, and even in the COVID swab line for our team. Emilie was pleasant to everyone she came across through the whole thing. She is a mom, a wife, goes to school, or you're done now.
Done with that.
Takes time for friends, is wicked smart, and always happy to be a resource for the community. Even still today, she does not hesitate to be there for someone with a question about COVID, despite the fact that she is not in ID anymore. She always impresses me with her smile and can-do attitude. She more than does her part, this past couple of years especially, and I couldn't be more proud to call her a colleague and a friend.